like the eighth
Yep.
demand all the way down. First
Yep.
is Thorax. So we go to aortic, pulmonic, Herb's point, tricuspid, and then mitral.
So a thrill would be like a rumbling feeling under your hand, and the heave would be like really a forceful lifting up of the chest.
Mm-hmm.
Okay, and as you're going, you can say, I don't can't appreciate any thrills or heaves.
Right.
So after you palpate,
Then we would.
you begin auscultating. So go ahead.
Could we do that while he's laying down, or do we
Yep.
have him sit
Yep.
up? All right, so we're gonna auscultate all the. Can I say eighth demand or probably not? Until he's a patient. So I'm listening for your aortic sound. So I'm listening for S2 here,
Okay.
and then I'm gonna move over to pulmonic. I'm listening for S2.
Mm-hmm.
Going down to Herb's point, listening for S2 sounds,
Mm-hmm.
and then going over to tricuspid, listening for S1,
Right.
and then mitral for S1.
Mm-hmm.
I heard them all normal rates and rhythms.
Okay. Then you have to do a full minute apical, auscultate the apical pulse for 1 minute,
Alright,
noting the rate, rhythm, and amplitude. Then you will do what?
then I'll tell him he's all good to go.
No, you're going to have him roll to his left side, and you're going to switch your stethoscope to the bell. Go ahead, do it.
Alright, I'm gonna have you roll to your left side, right? Switching to the bell. Then I can stay on this side or I have to go opposite side.
You should always be on the right side anyway. So you should have been on the right side the whole time. But so you're going to listen to the mitral area, which is where
Mitral is fifth intercostal space.
Right. with your bell. Yeah.
What do I do with this arm?
Sleep right there. I'll take it off.
No. Sean, you're on the wrong side of the chest.
The other side, the
Oh.
side that.
Well, wouldn't it be better for him to lie on the other side then?
No, it's in
No,
other words,
you were supposed to be on the right side, so you were just like.
So you're supposed to be on this side.
He doesn't have to go over. Yeah.
I'm like, you don't go over me.
Remember where the heart is. The heart's on the left side, so you're gonna have him roll to
Well,
the
you're
left.
thinking you don't even really.
Yeah. Okay, you're good. Okay, then
We're listening for mitral there.
yes, any murmurs, and then you don't hear any, right? And then you're gonna palpate all the pulses. It's bothering me that he's laying flat there. Can we lift him up a little bit? It's one thing with pregnant women.
I'm not a pregnant boy.
All right. Okay, now we palpate all the pulses, and where would they be?
I'm gonna start with the radial pulse.
Okay, so
right there.
right, and
Check
then
them bimanually, then do brachial. Then we can do popliteal. We'd have him lay on his belly, right, and do it. All right, popliteal.
or you could also have him bend his knee and do both sides like this
Mhm.
to palpate.
And then we do. Is it the dorsalis pedis?
Right.
And then the tibialis posterior
Good,
one.
good. And that's
Bilateral.
that's all I have you do is show me where. And
We're
there's
gonna
one
say
more.
like we're checking for skin
One more
tone,
that you,
atrophy,
the femoral.
hair, femoral. Yeah, I'm not doing that.
You were good.
And then you just check for hair distribution, make sure
Right.
it's even, make sure there's no like thinness of the skin.
Edema.
Edema, press on it.
Your temperature, right?
Temperature
Color.
and color.
All right. Then what about assessing for arterial insufficiency?
Arterial deficiency.
That's when he lies back. And
That's one where you raise his
raise
legs
your
up.
legs.
All right.
Right. But before you do that, you should probably do the Allen test. How do you do the Allen test?
Give me your wrist. I'm gonna squeeze right here,
Mm-hmm.
and then squeeze or make a fist. All right, and then we're gonna let go, or you can open your hand back up. When we let go, we should see it fill back up. And it tangles a little bit, right? And we can also check for capillary refill, right?
Mm-hmm.
Make sure under a second, and then should we do capillary refill on the toes too? Probably, right?
You can. I wouldn't penalize you if you didn't. Now, the one thing you want to do to be like, you want to make sure that you're doing some of the stuff. Like, in other words, I would look at the extremities while he's lying down, and then do the arterial insufficiency while he's lying down, because the last thing you want him to do is stand up. And as he stands up, you're going to look at with the arterial insufficiency at the blood returning to his feet, and at the same time, then you'll have him turn around and you'll look at his legs for any varicosity.
Yeah.
The heart is probably one of the better ones to get.
Mm-hmm. Was there like a DVT test where like you squeeze the calf or something?
Oh, the Homans, right? So yeah, So, yeah.
We do normalize it on there too. I'm gonna lay it down together.
And I think you're on your sheet, it probably is all on there anyway, so you're not gonna forget.
And we have the sheets in there, so we could just keep referring to it.
Yep.
Okay.
So,
Again,
for the arterial one, we literally lift his legs up like this, right?
Yeah.
And you wiggle your feet.
Wiggle your toes for me there.
And then, yeah, for like 30 seconds, I guess, and
Alright,
then,
well, he doesn't have his
right.
feet exposed, so
And then you would have him stand up.
stand up.
Push up. And then you would watch the blood return, and then you go around the back, look at his extremities
Mhm.
while he's standing for any varicosities. And that's it. That's pretty much it. So it's just making sure.
Hi Tyler, I'm Chelsea. I'll be your student nurse today. Can you tell me a few reasons why you're here today?
Because of my physical.
Okay. Alright, so we're just gonna check the thorax. And will they be in their
Yes, they'll
Yeah.
already be, yes, yeah.
uniform?
No, they're wrong. You mean gown.
The gown.
Okay, so what do you do first for any system? What's the first thing you do?
Vitals.
Well, no, you're not gonna do what else.
This one too.
Go ahead, what else?
Subjective data?
You did that, what else? What's the physical part? What do you do first? PPA, what's first?
Inspect.
Okay, okay.
So then I can just ask him if he can turn around.
Right,
If you could just hang your feet over on the other side for me.
right, because we're only doing, when we do the lungs and thorax, we're only doing posterior thorax.
Okay.
Okay.
So then I'll inspect his back, make sure his transverse is greater than his apical, right?
Anterior.
Anterior, posterior. Check the midline, make sure everything is vertical, that there's no scoliosis, lordosis, kyphosis. With that, would you have them, like, ask them to bend?
You
Can bend
could.
for me?
A little bit, yeah.
Okay. Skin color looks all even. I mean, I guess I could touch. Temperature, it's all good. No lesions, no masses or lumps.
You're looking at the symmetrical alignment of the scapula, that they're straight. You will palpate, so palpate is next, right? You would be palpating the spinous processes.
Okay. Any tenderness?
Nope.
Okay. No swelling.
You're noting the rib cage is sloping downward at a 45-degree angle.
Okay.
And you'll be counting, and you'll count,
Yeah.
and you will count the respirations without him knowing it. But
Right.
yeah. Okay, go ahead. Then what?
Now I can. Okay.
Symmetric,
Excursion.
symmetric chest expansion.
Alright, so I'm just gonna pinch the inward at the 10, 12.
10.
Tennis around there.
Yep.
10.
And
ahead.
then I'll have you
Usually
breathe
there.
in. And breathe out.
And what are you noting?
That's symmetrical.
Right. Okay. Good.
There's no, what is that, pneumothorax, no
Atelectasis.
Yes.
Yeah, okay.
uh,
Next, you're going to do tactile fremitus.
alright, so that's, I'm gonna say the word 99, and I
No,
want
he's going to.
you're gonna say the word 99. And I'm gonna check for equal vibrations.
Mhm.
Okay,
99. 99.
Good.
99.
good, one more.
99.
Good. So four different areas, or as you come down. Now you'll auscultate.
Okay, so now I'm just gonna listen in, and I'll have him breathe each time. Take a breath each time I go to a new spot.
So 6 positions. First, the left and right between the scapula.
Okay, breathe in. Breathe out. Breathe in. Breathe out.
Then a T10.
Out.
Axillary. So the other sites. Yeah. And then,
Last one.
what are you hearing?
Lung sounds. Yes, for no adventitious sounds.
Okay.
Or not bruise, but adventitious.
Bronchovesicular sounds between the scapula and vesicular and all other areas. So then you're going to get that stethoscope back out again. You're going to do egophony
Okay, so
in all the same 6 spots. You're going to ask him to do what?
say the word E, or like Jamie, and I should not hear an A. I should hear an E.
That's correct.
Okay, so just say the word Jamie at each point.
Jamie. Jamie.
Good.
Jamie. Jamie's gonna walk into the Jamie.
Record it and say.
Jamie.
Good. And one more.
Jamie.
Good. Okay, I heard E throughout.
I just want to remind you that for me, I feel the same way as Janelli in that usually it's IPPA, so auscultation would be last. But when you percuss, you can really bang stuff around the chest, and it may not give you the correct assessment. So if you listen first before you do percussion, it's probably more accurate. But depending upon Professor Lincoln, if she gives you a hard time about it, just tell her that that's how you were taught.
Okay.
Yeah, so she should be fine with it.
Okay, and then the last one is the
Percussion.
Percussion. With that one, do you want us to go, I forget, straight down or side to side?
It's always side to side.
Side to side.
So what should you be hearing or feeling?
Resonance. And then if you hear dole, you're on a bone
Right. Or a mass.
or a mass.
So what about diaphragmatic excursion? How do you do that?
So that one is you percuss down, have them breathe in.
You're on one side only.
Yeah.
So you would explain to the patient, I'm going to have you take a deep breath in and blow it out. When they blow it out, the lungs are higher up in the chest. So you'd start coming down till you don't feel resonance. Now you're not over air, you're not over the lung. And you mark it. Then you have them breathe normally because they're not going to turn blue. And then you have them take a deep breath in and hold it with your breath in. So now the lungs are full. So you start from where you marked it and come on down to see how much further down the lung is as opposed to when it was in. You know what I mean? So that's your diaphragmatic excursion.
Are you
You
actually marking it or like just
You are.
mentally? Okay.
You are with a pen, and then you can wipe it off with some alcohol and you're done.
And that's, what was that supposed to be? Like 3 centimeters? 5
Yeah,
centimeters?
3 to 5 centimeters.
So I'm just gonna have you breathe in and hold it.
No, breathe in and blow it out, and then hold it.
Blow out.
It's on my paper. You study this, you'll know.
Okay. And now breathe in and hold.
Good. And like I said, I think it's a very difficult skill to master. But if you're doing it, if you show us that you're doing it correctly, whether you feel like you're doing it correctly or not, just do it.
Yes. Hello, my name is Tyler. I'm going to be your student nurse today. Can you just confirm your name and your date of birth?
Tony, date of birth, 10/15/21.
That's what I got. Okay, very nice.
21.
21.
Stop it.
My great
He's an old
grandma.
guy. Show some respect. All right, so we're going to be assessing your musculoskeletal system today, okay? All right. We start with, I've done all the beforehand stuff. So, start with inspection. I'm going to start at the top and work my way down. Okay. We'll start with your jaw, okay? So I want you to open your jaw and then close it again. Nice and relaxed, nice and normal. Okay, and then move side to side with your jaw. Like kind of like this, just your jaw, not your head. Very nice, okay? And then like a cow is like chewing, like kind of circular motion. Okay, very nice, very nice. I'm gonna feel now too. Okay? I'm gonna now palpate. Okay, so I'm gonna check for your TMJ.
Sure.
All right, I'm gonna be right here. I want you to open your jaw, nice and wide, and then close it. Okay, one more time, and then close it.
So, Child, I think that you really should be using your 2 fingers instead of your thumb
Okay,
over that joint.
can I do it one more time?
Yeah.
Okay, go ahead. And then close it. Like that?
Yep.
Okay. Very nice. And we're gonna do your head now, okay? So I want you to like shake your head as if you're saying no, and then as if you're saying yes, okay? And then your ear, I want you to touch your ear to your shoulder, and then your other side. Okay, any resistance, any pain?
No.
Nothing? Okay, good. And what about like a big circle? And going the other way? Very good, very good. Now we're gonna do your shoulders. I want to test for, first of all, before I let me backtrack, go to your head again. I'm gonna have my hand on the side of your face, and I want you to give me some resistance to my hand. So go ahead and push on my hand. Okay, very nice. We're gonna do the other side. Okay, very good. So muscle strength is even.
Okay.
and
What's
pressure-
the rate?
What's the grade? Oh, jeez.
0 to 5.
3.
No,
Is
it's
3
10 to
normal?
5.
Oh,
He's-
okay.
he's got-
Because
he's
normally
got-
the middle
full,
number is
full.
normal, right? Yeah.
Yeah, for grading of the muscles, 5 would be
Five.
normal.
5 is normal. Okay,
It's
5.
Complete strength. Full
yeah,
strength.
full strength, against resistance or gravity, and full range of motion. Yeah.
Okay.
Yeah.
Now we'll go to your shoulders.
Sure.
Okay. I'll do the same test, but with your shoulders. A test for muscle strength. Okay. So go ahead and shrug your shoulders up. Very nice. Okay. Grade of 5. We'll test for. So I want you to move your shoulders in a bunch of different ways, and I'll walk you through it. Okay. So we'll do the shrugging the shoulders first. We'll start there. Okay, and then relax them. I want you to take your arm, and we're gonna bring it out and bring it back in. You with the other side too. Okay. You might want to slide over to one side of the chair so that you have some room for the next one. We'll do a big circle with your arm, with the other arm, so that you have room. Okay. Any pain? Any resistance?
No.
No. And I would do the other side.
Yeah, okay.
I'm just gonna.
Yeah, do
Okay,
the other ones. Yeah,
thanks.
just tell us. Yeah.
Very good. And then
Oh, back of head.
what? Oh yeah. Okay. I'll have your hands, and we're gonna put them behind our head. Okay, very nice. And then we're going to put them on your hips. Okay. What is it called again? It's
Internal, external rotation.
Internal, external rotation. Okay. Then we'll do your elbows.
Sure.
Okay. Go ahead and flex, and then extend. I would do the same thing with the other
Right,
side.
right.
And I'm going to test for muscle strength too. So go ahead and flex that arm against my hand. Okay, very good. And go ahead and put it in a flex position. And I want you to extend that arm against my hand. Very nice. Okay, we'll go to the hands. Yeah. Okay, now I want you to pronate and supinate. So we're just kind of like twisting our hands. Okay, very good.
You'll be palpating the joints. You have to palpate all the joints. So you should palpate the shoulder and palpate the elbow.
Okay. How would I palpate the shoulder if he's like moving like?
Well, you could just palpate it. Any tenderness when I press.
Okay.
Any tenderness when you're moving.
Oh, I see. So.
Yeah, like the
Okay.
exit joint.
You could just ask. Yeah.
Okay, so I'm gonna do that. Okay. Go ahead and move your shoulder just a little bit. Any pain? Any tenderness?
No.
Okay. What about on this side? Okay, very good.
And then with all the joints, you're looking at the skin color and palpating for heat. So and looking for swelling.
Okay. Same
See,
thing.
the muscles isn't easy, but you gotta remember all this
Yeah,
stuff.
it's like a lot. Okay, now with your hands, I'm going to go ahead and feel for here. Go ahead, you can move your fingers a little bit. Any pain, any resistance that you feel?
No.
Okay, I would do the same thing with the other side. Go ahead and fan your fingers out and bring them in and wiggle them. Okay, very good. What am I missing? Oh, like
Yep.
Fallon's test. Okay, well, I'm gonna have you hold this position for 1 minute. Okay, and 1 minute has passed. Go ahead and relax, and you can shake it out. Do you feel any pain?
No.
No? Okay, so negative sign for carpal tunnel.
Dog pose.
Gosh, you're so much. We'll have our hands up like this, and I want you to put them down in this dog pose. Is that what we're
That's
calling
what I
this?
called it.
Is that what you want to call this? And bring them right back up. Okay. Any pain? Any resistance? Okay, very good. What am I missing?
Nothing. Keep
Okay.
going. I think you're
So
good.
now we're moving down.
Pinch the elbow in the back.
Well, you should palpate. Yeah.
That would be like the joint.
We can move it down to our thorax region. So, actually, you know what? I'm gonna do legs and I'll come back for thorax
Okay,
so that he's
okay.
just sitting
Okay.
for the whole time.
Okay.
I'll do, okay. So, we'll go down to our legs. I want you to extend your leg up, okay, and bring it down, okay, and I'm going to go ahead and give me some resistance for the same thing. Very good. And have your leg up already, and I want you to bring it down against my hand. Okay, very good. Any pain, any resistance? Okay, very nice. And same thing with your foot. I want you to bring it up against my hand, okay, and keep it up, and now bring it down against my hand. Good. I would do the same thing with the other side. And I would feel for the knees, any pain, any discomfort, okay? And the same thing with the ankles. And
So the ankle range of motion, you would invert or evert. You already did flexion extension.
circumduction? Is that?
Didn't remember.
Can you do that with your ankles?
No,
No, right?
No, that's not a.
Not with that one. Just that one. Then I would go into a PQRSU. Oh, isn't there? I can lay him down.
Right,
Okay,
right.
okay. I'm gonna go ahead and lay it down. And I'll bring this up too, so you have somewhere to rest your legs at. Okay. All right, and I want you to go ahead and lift your leg, and I'm going to palpate as he's doing all these, so I can also kind of guide him too. And we're gonna bend our knee, okay? And we're gonna fan our knee out and bring it back, and back up, and back down. And the same thing with the other side. Any pain, any resistance? Very good.
Hip. You can like extend.
Bring it out, bring it in.
Adduct
Yeah,
and
right.
abduct.
No,
You did-
I think
right
that's
arm?
No, you did.
Oh, okay,
you
you're
kind
right,
of
you're
like
right.
flexed and
Okay.
extended
Okay.
My
And
head, I
did you do strength? The muscle
Um,
strength?
against
Yeah.
you
muscle
Okay,
strength.
yeah.
Yeah, like as
Oh, you
I'm,
did.
of hip.
I guess I'm kind of doing that at the same time.
And you're checking that knee for bulge?
Knee for bulge, no bulge presence, no
Okay.
bursitis. I think I can bring him up now, but I'm not
Okay,
sure.
yep.
Okay. All right, I'm gonna go ahead and raise you up. I'm gonna bring this in. You can sit up. And I'm gonna have you stand. We'll do our midline. So I want you to twist your body side to side. Okay. And then I'm gonna go behind you so that I can check for scoliosis at the same time as you go ahead and bend over, down, and to go ahead and try to touch your toes. Okay, you can bring yourself up nice and slow. No
Lean back a
scoliosis.
little bit. Hyperextend, yeah.
Hyperextend, okay. And then back to normal position. And I think that's
And I guess gait you would have noticed anyway, when they walk, when
Okay.
I had them walk, yeah.
gait was normal.
Okay.
All right, very nice.